Stomach is a hollow organ, found in the abdominal cavity, just below the thoracic cavity on the left, which is separate from it by diaphragm. Stomach is elastic and can stretch up to 4 liters. Non-stretched stomach is about 50 milliliters. It is part of the digestive system lined by mucosa lining. Superiorly it is connected to the esophagus, and that part is called cardiac part of stomach. The area above the point where esophagus enters is called the fundus of stomach. The inferior part where the duodenum and stomach meet is called pyloric part. Between the pyloric part and the fundus is the body. The body is the largest part of stomach, almost 75% of the stomach. The stomach is lined by glands that secrete gastric juice. Gastric juice is mostly composed of 99% water and 1% solids. The stomach has so many functions in the human body. 1. Stomach stores food for about 3 to 4 hours before it is released into the intestines. 2. The peristalsis movement of the stomach turns food boluses into chyme. 3. Enzymes found in the gastric juice produced by the gastric glands digestive food particles. 4. Some toxins of the body are excreted through the stomach. 5. Stomach walls also produce mucus which protect the mucosa of stomach from mechanical or chemical damage. 6. Hydrochloric acid produce kills bacteria that enter the stomach and provide an acidic media. Although the stomach has its protective mechanism, it is also prone to harm that cause disorders of the stomach. For example, gastritis. It is the inflammation of the gastric wall. This leads to decreased size of the stomach, hence decreased gastric juice secretion. Gastritis can be acute or chronic. Acute gastritis is caused by excess consumption of alcohol, excess intake of aspirin. During procedures such as insertion of nasogastric tube, the mucosa of the stomach can be harmed. Repeated exposure to radiation and some bacterial infection can cause acute gastritis. This acute gastritis involves inflammation of superficial layer of stomach. The deep layer can be inflamed by chronic infection, or long-term intake of alcohol, or long-term use of non-steroidal anti-inflammatory drug. Signs and symptoms that may suggest gastritis include 1. Burning sensation on the stomach area that causes pain. 2. Nausea. The urge to vomit but doesn't always results in vomiting. 3. Loss of appetite. 4. Discomfort in the stomach area. 5. And sometimes belching and also indigestion. Another disorder of the stomach is gastric atrophy. Gastritis can cause the stomach and gastric glands to shrink. This is called gastric atrophy. Under normal circumstances, it doesn't have any noticeable symptoms. When gastric analysis is carried out, there is always decreased secretion of hydrochloric acid and gastric juice. Another common gastric disorder is the peptic ulcers. This is the erosion of the surface of stomach. This erosion is mostly caused by gastric juice. Other causes of peptic ulcers are 1. Stress. 2. Long-term use of some drugs. 3. Smoking. 4. Excess species foods. 5. Excess secretion of gastric juice. Some symptoms and signs that may suggest peptic ulcers include 1. Pain in the epigastric region. 2. Nausea. 3. Vomiting blood. 4. Heartburn. 5. Weight lose. Another disorder is the Zollinger-Ellison syndrome. This is caused by excess secretion of hydrochloric acid. It occurs when there is a tumor in pancreas, which leads to high secretion of gastric juice and hydrochloric acid. Some of the signs and symptoms of Zollinger-Ellison syndrome include abdominal pain, vomiting blood, diarrhea, and difficulty in eating. If you found this video educative, please like and subscribe.